Adenoiditis is a condition that occurs when the adenoids become inflamed or infected. The adenoids are a small mass of tissue located at the back of the nose, high up in the throat. They're part of the body's immune system and play a crucial role in fighting off infections, particularly in young children. While adenoids are meant to trap germs and prevent them from entering the body, sometimes they can become overwhelmed and get infected themselves. These small, spongy tissues are similar to tonsils, and like tonsils, they're most prominent in children. As we grow older, adenoids typically shrink and may even disappear completely by adulthood. This is why adenoiditis is primarily a childhood condition, though it can occasionally affect adults. Adenoiditis is a fairly frequent condition in children. Most cases occur in kids between the ages of 3 and 7, but it can happen at any age during childhood. Causes of adenoiditis. The causes of adenoiditis are varied and can include bacterial or viral infections. One of the most common bacterial culprits is streptococcus, which can lead to a sore throat and subsequent adenoid inflammation. Viruses such as the Epstein-Barr virus, adenovirus, and rhinovirus can also cause adenoiditis. In some cases, allergies can cause the adenoids to become inflamed and swollen, making them more susceptible to infection. Environmental factors can play a role too. Exposure to irritants like cigarette smoke, air pollution, or chemical fumes can irritate the adenoids and make them more prone to inflammation and infection. Chronic or recurrent adenoiditis can sometimes be linked to other health conditions. For example, children with weakened immune systems or those with chronic sinus infections may be more likely to develop adenoiditis. In some cases, gastroesophageal reflux disease, or GERD, can contribute to adenoid inflammation. Symptoms of adenoiditis. The symptoms of adenoiditis can vary from mild to severe, and they often mimic those of other upper respiratory conditions. One of the most common symptoms is difficulty breathing through the nose. Children with adenoiditis often breathe through their mouth, which can lead to dry mouth, bad breath, and even changes in facial appearance over time. Snoring is another common symptom. When adenoids are enlarged, they can partially block the airway, leading to noisy breathing during sleep. In severe cases, this can even cause sleep apnea, where breathing is repeatedly interrupted during sleep. Parents might notice their child gasping or snorting during sleep, or seeming unusually tired during the day due to poor sleep quality. Nasal-sounding speech is often a telltale sign of adenoiditis. Because the swollen adenoids block the passage between the nose and mouth, a child's voice might sound as if they have a stuffy nose all the time. This is often described as talking with a nasal twang. Recurrent ear infections are another common issue associated with adenoiditis. The adenoids are located close to the openings of the eustachian tubes, which connect the middle ear to the back of the throat. When adenoids are swollen, they can block these tubes, leading to fluid buildup in the ears and increasing the risk of ear infections. Children with adenoiditis often experience a persistent runny nose or nasal congestion. This isn't just the typical runny nose that comes with a cold, it tends to be more long-lasting and may be accompanied by thick, discolored mucus. Some children might also develop a cough, especially at night, due to postnasal drip. In terms of how these symptoms feel, children often describe a sense of fullness or pressure in their nose and face. They might frequently try to clear their throat or make snorting sounds in an attempt to breathe more easily. Younger children might not be able to articulate these sensations clearly, but parents might notice them rubbing their nose or face frequently. Pain isn't typically a major feature of adenoiditis, but some children might experience a sore throat, especially in the morning. This is often due to mouth breathing during sleep, which can dry out and irritate the throat. In cases where adenoiditis is accompanied by a sinus infection, there might be facial pain or headache. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of adenoiditis. Diagnosing adenoiditis can be a bit challenging because the adenoids aren't easily visible during a routine physical exam. Doctors typically start by taking a detailed medical history, asking about symptoms and their duration. They'll perform a physical examination, looking for signs of mouth breathing, listening to the child's breathing, and checking for signs of ear infections or sinus problems. One common diagnostic tool is a lateral neck x-ray. This can show the size and shape of the adenoids and how much they're obstructing the airway. However, x-rays aren't always necessary, especially in clear-cut cases. In some cases, especially if symptoms are severe or don't respond to initial treatment, a doctor might recommend a procedure called a nasopharyngoscopy. This involves inserting a thin, flexible tube with a camera on the end through the nose to directly visualize the adenoids. This can provide detailed information about the size of the adenoids and the degree of inflammation. Treatment for adenoiditis. Treatment for adenoiditis depends on the severity of the condition and its underlying cause. In many cases, especially when the cause is viral, adenoiditis will resolve on its own with time and supportive care. This might include rest, plenty of fluids, and over-the-counter pain relievers to manage discomfort. If the adenoiditis is caused by a bacterial infection, antibiotics may be prescribed. It's important to complete the full course of antibiotics as directed, even if symptoms improve before the medication is finished. This helps ensure that the infection is fully cleared and reduces the risk of antibiotic resistance. For chronic or recurrent adenoiditis, or cases where enlarged adenoids are causing significant problems like sleep apnea or frequent ear infections, surgical removal of the adenoids or adenoidectomy might be recommended. This is a relatively common procedure in children and is usually done on an outpatient basis, meaning the child can go home the same day. An adenoidectomy is typically performed under general anesthesia. The surgeon removes the adenoids through the mouth, so there are no external incisions. Recovery is usually quick, with most children returning to normal activities within a week or so. While the idea of surgery can be scary for both children and parents, the procedure is generally safe and can provide significant relief from chronic symptoms. It's worth noting that while adenoids play an important role in young children's immune systems, their removal, when necessary, doesn't significantly impact overall immunity. By the time adenoid removal is considered, the child's immune system has typically developed enough that other parts of the body can take over the adenoid's protective functions. Home remedies for adenoiditis. For milder cases or as a complement to other treatments, there are several home remedies and lifestyle changes that can help manage adenoiditis symptoms. Using a humidifier in the child's room can help keep the air moist, which can soothe irritated airways and make breathing easier. Elevating the head of the bed slightly can help with nighttime breathing and reduce postnasal drip. Nasal saline rinses can be helpful in clearing mucus and reducing congestion. These can be done using a neti pot or saline spray. It's important to use sterile or distilled water for these rinses to avoid introducing additional bacteria or other microorganisms into the nasal passages. Encouraging children to drink plenty of fluids can help thin mucus and make it easier to clear. Warm liquids like herbal tea or soup can be particularly soothing. For older children, gargling with warm salt water can help relieve throat discomfort. It's also important to create a healthy environment. This includes keeping the home free from irritants like cigarette smoke and strong chemical odors. In homes where allergies are a concern, regular dusting and vacuuming, using allergen-proof bedding, and keeping pets out of the child's bedroom can help reduce exposure to allergens. While adenoiditis can be uncomfortable and disruptive, it's generally not a serious condition. With proper treatment and care, most children recover well. However, it's important to follow up with a doctor if symptoms persist or worsen, or if there are frequent recurrences. Now, we want to hear from you. Have you or your child ever experienced symptoms similar to adenoiditis? What was your journey to diagnosis and treatment like? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.